So welcome, everyone. I'm trying to get us back on track, also because we have a lot to say in these 2 hours. The topic of data and the importance of its governance has been, I would dare say, a very consistent theme through all day yesterday and all day today so far. I was quite happily surprised how it came into conversations, all the other conversations that I've been involved in so far. So this is a session where we get to unlock the practice of health data governance. And this is where I'm thrilled to be moderating this discussion today. My name is Eric Sutherland. I work with the Organization for Economic Cooperation and Development, otherwise known as the OECD, based out of Paris. And one of the things that the OECD has with all of its member countries is a declaration around the importance of health data governance, which we published back in 2016. And recognizing the global importance of health data governance to transform health, developed their principles back in 2021? Yeah, and fortunately, those two sets of principles are highly aligned, highly coordinated, highly integrated with each other, and frankly, the Transform Health principles are better packaged. And so they're more easily consumed, and I think it's really important that we have a strong partnership between the OECD and Transform Health to really propagate the importance of health data governance, in particular in a world where we're trying to drive the value of artificial intelligence. Because as we have clearly heard, artificial intelligence without data is like taps without water. It's totally useless. Looks really good, but you're not getting anything out of the system. So if we think of that analogy, where even the technologies we have are the pipes and the taps look out. We can look like we're doing great stuff if we install pipes and we install taps, but we don't get anything if we don't curate the water, the data that flow through the systems. And we've heard a lot about data are the new oil, data is the fuel of the systems, and I really don't like those analogies, very personally, mainly because the concepts of fuel create something that is an inexhaustible resource. And one of the unique attributes around data is that it is not a consumable resource. It is something that adds and increases in value when it is shared, when it is used, when it is made accessible. And that is one of the important aspects of what health data governance brings, is ensuring that data and optimizing the use of data overall. So with that, I want to get to know a bit about who the audience is so we know who we're talking to. If we can bring up the Mentimeter. Ting. We'll see if it comes up and we'll see if we can get that working. Cool. So scan the QR code and type in what industry you're in. I suspect many of you will join me in the giant word health, but we'll find out. And while you guys are doing that, I'll give you some interesting statistics because I am with the OECD, and that's what we do, are interesting statistics. So what I will say is, and we heard a bit of this yesterday, but they didn't attach numbers to it. I will now attach numbers. 30% of the world's data are health because of the sheer volume of data you get out of things like genomics and testing and MRI scans, et cetera. Although we did hear yesterday that 5% of that data are used for decision-making purposes. If you multiply that through, it means that 28% of the world's data assets are unused. We're spending massive amounts of time, energy, resources to collect and store that data that are never used. That is negligence. And this is why, if we were properly governing our data going forward, then I think that we can unlock that value. And that's where the power of AI really comes in. Allows us to meaningfully unlock that value for the benefit of all. So, not surprisingly that we're a whole lot of health people, but an interesting other perspectives. I like the law and advocacy and academia health and policy, which is really interesting. Indigenous peoples, love to see that. By the way, got my little Canada pin on today. Solidarity, but also respecting the First Nations peoples of Canada, First Nations, Inuit, and Métis, as well as the Aboriginal peoples of Australia, and Aboriginal peoples all over the world, and we'll hear more about that later on. Some of the other Indigenous populations that exist around the world. So, with that, flip on to the next page. So, where are you from? So we're largely health, but we have a bit of diversity amongst our group. I suspect that we're probably largely Southeast Asian, but you never know. I threw in a little European dot because I live in Paris. But not going to be surprised, there's a lot of dottage that's happening around Southeast Asia.
We don't see South Asia.
But South Asia. Ah.
There's no South Asia.
There's no South Asia. Good point.
That's why you see.
Oh.
That's why we put ourselves in Southeast Asia. We love it.
You know, I think that's a good learning for next time I do a poll like this. Thank you. Take that as a learning. Also reflecting that Eastern Asia, people like in, not the Western, sorry, trying to get my directions right, Western Asia, where you get toward the Israels and Saudi Arabia and that would also be another thing, which I guess is the Eastern Mediterranean. Anyway, so we're largely South Asia or Southeast Asia. Go on to the next page. And just to be more specific, what country you're based in, I expect a giant Thailand to be showing up here. I didn't test this one, so you don't see a giant Canada or giant France, as it turns out. Sri Lanka, thank you. Should head down to Colombo. Philippines, okay. We don't have a Thailand yet. Oh, there it is. Okay, knew it was going to come. Give some good USA there too. So South Asia, some Western Pacific region. I am truly trying to learn. But okay, good. So we have good representation around this area, but it also helps direct us in terms of the types of experience we will share. As we will learn, our panelists represent many parts of the world, but largely in that Southern Asia, Southeast Asia region. I like the Thailand flag. That's nicely done. Go on to the next question, and then we'll get to some more content. So, are you aware of the laws and regulations that your country has to govern health data and how it is collected and used? And, I don't know if we expect to have, I'm not going to be surprised it's about a 50-50 split. Well, it's racing. It's kind of fun. Who do you think is going to win? Do we do a coin toss? So, yeah, it's an even split either way. Cool. And flip on to the next page, which is the last page. And so this, I think, will guide much of our discussion, because in the context of health data and health data governance, what are the major roadblocks to adoption of health data governance? Political will. Yes. And is it political will to do it, or the political will that are there? Lobbyists. Huh. I need to mentally think about this to unpack some of these things later on. Corruption, fragmentation, huge. Yeah. And one of the things I will say, like fragmentation we heard about time and time and time again in the last 2 days. The way I think of it, with the way that we're developing our AI solutions based on or build on the massively fragmented data assets that we have around the world, what we end up creating is AI solutions that cost a lot more to deploy because they're in fragments and achieve worse outcomes than they would if we were to work together. And so one of the important things that I think is really going to come out from this conversation is not only the importance of health data governance, but also the importance of collaboration and the importance of networks, the importance of connecting our various data assets together across institutions in order to achieve better health outcomes for the entire population that are served by those institutions. And that's one of the key things that I think are really there. And I really want to unpack data privacy, but we'll come to that later on. Save some of your questions that are implied by here for the Q&A. Have a think of it. We will have time for that. But with that said, thank you for your good advice. We'll pause there. In fact, we're not going to advance the slides. If you have other thoughts, we can come back to this picture. But for now, I will first introduce Matilda. So Matilda is a fantastic colleague from the Transform Health, their CEO, their founding CEO, and has really driven the conversation around the responsible approaches to data use. And Transform Health is a fantastic organization in terms of all the things it's done. So I'd love to hear more about it and hear about you, your journey, and everything about this stuff. Thank you.
Thank you, and I think I need to stand up on this thing because it's and put this down maybe. Can I? No, I can't do that. Okay, we will manage. All right. So thank you so much, Eric, for that introduction. My name is Matilda Forsland, and I'm the Executive Director of Transform Health. We're a global coalition of more than 215 organizations, I believe, that is advocating for digital transformation to achieve universal health coverage. And we have national coalitions in more than 6 countries now. We also work very closely with a number of regional networks. And data governance is a very important agenda that the coalition has been driving over the last 5 years. So, as we all know, digitalization and the use of digital tools have become an integral part, and I don't think my slides are working for some reason. Here we go. Okay. Has become integral parts of health systems and health service delivery. And health data is also integral to closing equity gaps and accelerating progress towards universal health coverage, as we all know. The digitalization has also increased the generation of health data, which is a vital asset and the foundation of 21st century health systems. So as we all know, health data is really important because it enables digital transformation and artificial intelligence. It improves research and innovation. It improves data-driven decision-making. It supports healthcare professionals. It strengthens equitable and resilient health systems, and the list goes on. But ultimately, it really enhances healthcare delivery and outcomes towards universal health coverage. So in order to achieve good health data governance, health data need to be effectively and equitably governed, including through a robust legislative and regulatory environment. And this is important to build public trust in health data systems and to fully harness the value of health data as both an individual as well as a public good. So it's against this backdrop that Transform Health and many of our partners are calling for more robust national legislation and regulation to govern how data is managed and used, and for a regional and global framework to be developed and endorsed by governments as a step towards maximizing the public value of health whilst protecting individual rights. So there's really growing consensus and wide political support for this agenda. And you can see some of the many strategies and initiatives just over the last couple of years that have been developed. So in the last couple of years at the World Health Assembly, Transform Health and many ministries of health have been driving this agenda at the sidelines of the World Health Assembly. We've had governments really commit their support and join us in calling for a global framework on health data. We've also seen recently there have been many new strategies, not least the Global Digital Health Compact that was launched at the Summit of the Future during the UN General Assembly this year, which sets out a commitment from governments on data governance. At the G20 in Brazil earlier this year, we had a Rio declaration from health ministers declaring the importance of building robust data protection framework and the importance of the alignment of legal and regulatory frameworks between countries. So these really represent critical opportunities to take forward action on this agenda, and I think we're really in a really important step to realize this. So it's against this backdrop that Transform Health and many other partners are calling for a global framework, as I mentioned, to be developed and endorsed by governments as a step towards more robust, equitable national legislation and regulation. And we see a global framework as a key step towards more robust national legislation. And you see here kind of 3 steps that we are taking. So first of all, we're building country consensus and commitment around a global standard for health data governance, and an essential area that should be addressed through national legislation. The second area is that we are establishing a level of compatibility in national approaches to foster greater legal coherence across jurisdictions and also to facilitate better cross-data sharing. And the third approach that we are taking is that we're providing a blueprint and a flexible framework that governments can use as a resource to strengthen national approaches. So, in support of these efforts, we have been stewarding the development of these equity and rights-based principles that Eric mentioned we launched in 2022. And they have been signed on and endorsed by more than 170 organizations and a number of governments as well. We have also developed an assessment tool, a landscape assessment tool, that can support national efforts to review and strengthen health data governance frameworks. We've also conducted 24 national landscape assessments of countries to really deepen the understanding of where countries are at the moment, to really understand where the gaps are, where the needs are, and where we can provide support. We're also raising public and political awareness and galvanizing action on this issue. We've been doing a lot of public engagement through a campaign that is called My Data, Our Health, where young people, marginalized communities are going out in their communities and asking for the right to their health data. And I think we're going to hear more from our youth representative on the panel later on this topic as well. We also engage in governments and convening discussions to build political support for the development of an endorsement of a global framework. As I mentioned, we've been doing a lot of work around key moments such as the World Health Assembly and also other kind of regional agendas and forums such as the Africa Union. And we've supported the development of a model law on health data governance, and also an implementation guide to support countries in strengthening legislative frameworks. So earlier this week, we relaunched our health data governance website, which contain all of these resources that I've mentioned here, the assessment tool, the model law, the principles, and you can scan the QR code here on the screen and it will take you to that website. So I want to highlight specifically the model law because this is really shaping our discussion here today. We have developed this together with partners as a tool for governments and a step towards a regional and global framework. So we worked with a team of legal experts to support the drafting of the model law, and it was informed by the equity and rights-based principles that I talked about before, and it was also developed through a consultative process of more than 1,000 stakeholders from across the globe, including several national ministries of health, that hosted consultation workshops in their countries to really develop this model law. So the model law contains core elements, a guidance and reference legal text to support more effective and equitable health data governance. It provides a blueprint and a flexible framework serving as a resource to assist countries with their efforts to strengthen national laws and framework. And is not meant to be prescriptive or imposing, but rather we see it as a tool for countries to use to contextualize to their own national frameworks and to use what's relevant and where there are gaps in current legislation to provide reference legal text and provisions for national legislation. So finally, to move this agenda forward, government leadership is really critical, as I mentioned, and I think we saw that from the Mentimeter just now. Political will is really key. So we encourage governments and other stakeholders to prioritize health data governance in order to advance and turn recent commitments that we've seen at these global forums and events into action. So we encourage leaders to ensure diverse stakeholders, including civil society, young people, marginalized communities, rights groups that really care about these issues, are at the table and are engaged in developing these health data governance for the future. So we urge governments to do 3 things. Sorry, I'm skipping ahead too quickly. The first one is to champion the development of a global and regional framework and to put this onto the agenda of the World Health Assembly upcoming this year and also in future years. We also hope that governments will endorse the health data governance principles. As I mentioned, you can find them on the website and go and endorse them there. And then also to join the journey to really strengthen national data governance frameworks with a model law as a blueprint. And we would love to speak to any government representatives here that is interested to come on this journey with us, together with many of our partners, including the OECD, the WHO, etc., to support national frameworks. Thank you so much. And back over to you.
Thank you for that very much, Mathilde. And there are so many fantastic things, and we'll unpack all of that with our panel today. So I realized I didn't really introduce myself. I just said where I work. So my role at the OECD is I'm accountable for the intersection of all things digital, including artificial intelligence, security, and data governance. So all of that, and health, be it primary care, acute care, pharmaceuticals, health workforce planning, financials, et cetera. So that's my little Venn diagram that I inhabit, which is why I get to hang out with all of you fine people. But that said, in that role, I'm often asked, why is health different? Do we need health data governance? Why not just data governance? And the conclusion, I think, is the hint of the answer is in the title of the youth initiative, the My Data, Our Health. Because the reality is health data are one of the rare assets that provides value simultaneously for individuals and for communities at the same time. And because of that, there are necessary ethical treatments that find a balance between individual rights and community rights at the same time. And I'm hoping that we can unpack that through some of our discussion. But with that, I will now introduce our panel. And we're doing a bit of a bait and switch on you. So I'll introduce the people who are here. I'll start with you, Dr. Kidong Park, who, if you were in the session earlier on, you've already heard him talk about all this stuff. But so, he's the director for data strategy and innovation in for the World Health Organization in the Western Pacific region. And he's providing the general perspective from regional areas and from the World Health Organization, Dr. Park. We also have Shalani Pewat. I should have asked you, sorry, Shalani, I apologize. I will ask you guys to properly introduce yourselves. Oh yeah, who is a member of the, Yeti for Health, which is, Yet for Health. I'm very bad at this, in case you didn't know. The Young Experts Tech for Health, but I like calling it Yeti, I don't know why. It's got an I in it in my mind. But providing that youth perspective in terms of those groups, as well as Nirmal Rajal, who is an independent freelance consultant from Nepal, who's been doing a lot of work with indigenous populations in Nepal. So I invite the three of you up to the stage, and we can start our conversation. And then the other person that's joining us online, previously, unfortunately, Dr. Fazella has taken ill, and so we have quickly found a way to get a replacement. So we have Jocelyn Tay, who is with the Malaysian Secretariat for EHIN, and who should be joining us online if we are lucky. I'm hoping that will work. Well, they're working it out. The art of the hello. We have a picture of Jocelyn. That's excellent. Excellent. So with that, I shall sit down. And what I could ask is maybe all the panelists, just very quickly, 30 seconds, who you are, what you do, and why you think, what contribution you're going to be giving around your perspectives around health data governance. I'll start with you, Dr. Park.
Yes, my name is Kidong Park. I'm working at WHO in the Regional Office for the Western Pacific based in the Manila, Philippines. I'm in charge of the data science, digital, and innovation. Since data is my area of the work, and then I will contribute to how WHO work on data governance. So let me quote my big boss, Dr. Tedros. He stated that the future of the health depends on how well we power health through science, research, innovation, data, digital technology, and partnership. Today, I want to discuss how WHO help you in harnessing the power of the data. Thank you.
Excellent. Love that quote too. Shalani.
Big shoes to fill after that. My name is Shailani Palihawadana. You can call me Shay. It's easier to pronounce. I represent Yet for It, Young Experts Tech for Health. We are a group of young people providing thought leadership. We'd like to think that in young people's engagement in digital health solutions, and we work very closely with Transform Health in achieving that. So me personally, I'm a lawyer by training, and I do a lot of things except practicing law. I work a lot in sexual and reproductive health rights, safe abortion, and also on GBV generally, and platforms like Meta and TikTok.
Excellent. And Nirmal.
Yes, a very good afternoon. My name is Nirmal Rizal, and like Eric said, I'm from Nepal. I'm engaged in research in the digital ecosystem since the last 4 years, after many years in international development. And that brought me to researching equality, equity, inclusion in the digital realm, and part of the process of getting here and being on the panel today was also a paper that we submitted, and I'd just like to acknowledge the presence of my co-author, Minal Kanti Tripura, if you could just hear. So I am a researcher, but Mrinal actually lives the life of indigenous people. He belongs to an indigenous group from Bangladesh, and he inspired me to kind of get into this research area and look at issues of inclusion and equity. So yeah, that's what drives me in this area in data governance. Thank you.
Fantastic. Thank you so much. And Jocelyn, confirming hopefully that you can hear us and you can come off mute and introduce yourself.
Hi everyone. Can you hear me clear?
So we can hear you.
My name is Jocelyn. Yeah. My name is Jocelyn, and I'm a pharmacist researcher by background who's passionate with digital health. I'm currently working with AHIN, Asia eHealth Information Network, as the Malaysia Secretariat, who is involved in health data governance advocacy work with Transform Health. since 2023. It is my great pleasure to join this session on behalf of Dr. Fadila, who is not feeling well at the moment, to join the session. We apologize for that. So I will try my best to share with you Malaysia's perspective and also include some of my point of views and experiences. Nice to meet everyone online.
Thank you for that. And thank you so much for joining on short notice, and thank you to the organizers to help facilitate her joining on short notice. So that said, let's get on with the panel itself. So I'm going to start with you, Dr. Park. From the World Health Organization's perspectives, what are some of the challenges and opportunities that you're seeing across the region when you think around health data governance in terms of data management, privacy, ownership, custodianship, sovereignty, the list goes on, and how is the WHO working with governments to really advance the conversation?
Thank you. The challenge. First, I agree with all of your response on the questions during the Mentimeter of the question as what was major block and the barriers in adopting of the health data governance. But let me use my privileges to talk more as a panelist. So let me name a few challenges we are thinking, the major roadblocks in progressing data governance. One, I would say fragmented and inconsistent regulatory frameworks. Many countries in the region lack comprehensive health data law, and still rely on outdated laws, some countries back to colonial periods, which are not sufficient and relevant in digital health record and technologies, such as AI-driven analytics. Also, the differences in national regulation also make difficult cross-border data sharing. It's very difficult. Second challenge I want to name is data sovereignty issues. Many countries in the region lack digital public health infrastructure to host health data platform and the databases. This raises concern of the sovereignty of the data and then its power to control their data, dependence on the development partners, technology providers, and also pave way for data ownership challenges. Third challenge I'd mention here is privacy and consent-related challenges. With increasing use of AI, big data analytics, and the privacy and consent have become bigger concern than before. Fourth one I would name as challenges increasing cybersecurity and the data breaches. Frequently, you will see the media reports of the data breaches. That increase the concern about people on their data privacy. However, I see a lot of opportunities. Good news is we are observing lots of the opportunity to address these challenges. Let me share opportunity, my opinion on this in three. First, increased awareness on the importance of data governance among decision makers as well as the public, which is most notable progress. The PMAC conference this week will create another opportunity, increase on awareness of the data governance more. Second opportunity I see is increasing investments in improving digital public health infrastructure, which could be leveraged to address data sovereignty challenges, and such as local data center, capacity development in key areas such as cybersecurity. The investments I meant, not only investment from international funders, I see increasing of the investments from local governments, from their tax-based budget. Third, we have some concrete solutions to materialize these opportunities. The data governance model law is one example. Another example is WHO curated this global digital health certification network and then digital health wallet, which demonstrate the power of the trusted data sharing across countries. It will surely facilitate the data governance and the policy actions in many countries, if not all countries. It will surely create fora to discuss and agree on the convergence of the data governance framework and then harmonization of the legislation between different countries. Then, your third question. What is the role of WHO? How WHO is doing this? So many things. However, today, let me share one concrete example. Example comes from WHO globally, not from headquarters, not from my regional office. So it is about establishing and then expanding global data health certification network. COVID-19 pandemic prompted the need of the digital transformation and then vaccine certification. Until couple of months ago, we should travel with vaccine certificates. We need digital vaccine certificates. And then WHO worked with the first EU member state in creating digital health certification network among EU member states. In 2023, in collaboration with EU, WHO launched Global Digital Health Certification Network. After 1.5 years of the implementation, now more than 80 countries signed up for Global Digital Health Certification Network. That means I will join the WHO network to share health data through your network. WHO also expanded use case, not only from COVID vaccine certificate to international health data exchange through this network. One success story is exchange of the international patient summary of the Haji pilgrims through Haji Health Card. This is a good case. I mean, sitting in one country of the ASEAN, Association of the Southeast Asian Nations, and then I know ASEAN member states want to move forward free ASEAN, integrated ASEAN, free movement. That requires free movement or free data sharing of your health, not prohibit your traveling. So WHO Global Data Certification Network will work in ASEAN if ASEAN want to move forward this. WHO is willing to work with partners and then countries in this area to make another concrete success stories. I stop here.
That's fantastic. And even in the digital health certification network, that's where one of the fantastic things between the OECD and WHO working together around that when some of the inception, but you guys have taken that far forward than we ever could. And that's exactly how the organizations are designed to work together, if I can dare say. So with all that said, I'm now going to try again to go to Jocelyn, and just to make sure that you can hear us. So from your perspective, sitting in Malaysia, I'm curious about the legal frameworks that have been put in place in Malaysia for that country perspective that support the governance of data, and what are some of the remaining gaps and challenges that you may face?
Yeah. So currently, Malaysia has Personal Data Protection Act since 2010, which governs health data as sensitive personal data. And we also have a new one, Cybersecurity Act 2024, that includes healthcare services as national critical information infrastructure. So other than this, there are also guidelines and policies that govern user access control, patients' medical records, and conduct of research using medical data. So at the moment, Malaysia is also currently working on the Omnibus Act, which could facilitate data sharing and cloud storage among government agencies, as well as a guideline on consent for health data processing. So Malaysia has been working very hard on digital health transformation in the coming years. And talking about the gaps of challenges that we still face, first thing I think will be the data sharing. So it's still a challenge here because it involves different parties, patients, providers, and organizations. And some data are still paper-based in Malaysia. So like about half of us are still using paper-based records, and hence, and some are electronic. So Malaysia is moving forward with this data sharing agenda with our Omnibus Act, as we can see. And awareness and data literacy is also another challenge. More education is needed in the country so that more people could understand the need for health data governance. And third gaps that I could share is ambiguity over who owns the data. So patients, healthcare facilities, or governments can create who are the owners. So this can create conflict and confusion. So it is important to increase the knowledge and awareness. I think it's still the same topic about it. So it is important to increase that of data among data owners, healthcare providers, and organizations about privacy and confidentiality to prevent misuse and data breaches. That's all from my side. Thank you.
Thank you very much. And all of those areas around the control, the challenge to data sharing, the digitalization and the paper-based processes, and trying to make sure that things are working together effectively and trying to get that coordination are all enormously important. Having said that they're important, it is often important to listen to the voice of the people who are most impacted by the transformation to make sure we're calibrating what our designs and our processes to the wishes of the people who are impacted by the systems, such as our youth representative. So, from your perspective, Shay, can you tell us a bit about how the Youth Expert Network has been working on health data governance, and what concerns are you hearing from people how it comes to how health data is protected and used?
Thank you, Eric. So I'll start with the concerns and gradually go into what we've been doing to address those concerns. So like you said, a lot of young people, I think almost all the constituency we can call as digital natives. By the time they are born, technology is also so far developed, so they associate like technology from a very early age. And for those like me who are transitioning out of youth category, still we started associating technology at a very early age, and we rely on technology quite a lot. So one of the main concerns, it also actually echoes what Dr. Park shared on challenges, data privacy and confidentiality. We do recognize that it is not just give in terms of use of data. There's a take as well from our end, and we are not clear as to how that take happens. And we are not sure, there's no particular clarity on how our data is being used, who's using it, and to what end. Particularly because, like Eric was mentioning earlier, health data is quite sensitive, and it could be used to discriminate and marginalize people. So, and also specifically in the current context of the socio-economic and political changes in the world, it has become that much more important. So my work also revolves a lot around sexual and reproductive health and rights. So I know, and so that's where I can bring examples from. So take simple period apps, where a lot of young women on a day-to-day basis track their period. And we don't know how that data is used for the most part. What we are saying yes to when we take the app, the fine print, a lot of us don't read. So and we don't know how it is being used. And technically, all of that data could be sort of collated to get an idea of how these women together menstruate, and also whether these people are women, and anyone who could get pregnant is pregnant or not, and whether they are getting an abortion, for example. So for a country, if they live in a country where abortion is restricted, then there's a clash. And another example that I can take from my own country, Sri Lanka, during COVID-19 times, there was a system of telemedicine, and the medication was posted to homes. We have a public health system. And a lot of the people that I work with who are living with HIV or have a different gender and a sexual orientation and a different gender identity, who were living in Colombo, the capital, but are coming from rural areas, did not, their families back at home did not know their HIV positive status or the diversity in terms of sexual orientation or gender. So this telemedicine system, what it did was that status that they wanted to hide from their families were divulged. It was done unintentionally, but there was a lot of damage. So, and there was no way for these people to get justice or exercise their right to privacy. That is why that is a big concern. A lot of these people were young people who've migrated to Colombo for work. So one reason why we need health data systems, governance systems to work overall to mitigate these issues. And a second point is on accountability and transparency, which is like a reflection of My Data Our Health campaign. So as of now, like Mathilde mentioned earlier, we mobilized young people to go and ask their local duty bearers on health data to access their health data. So what we found is over 50% of young people did not get access to records of their own health data. And there was about a 23% who got access, but with constant follow-ups. And another 20% did not, they got access immediately, but that's compared to the rest, it's a small percentage. And another interesting thing that we saw was in terms of accountability, that for those who had to follow up, when they went to their local health officer or medical officer of health, etc., they would say, oh, you need a permission letter from this other authority to get access. And then we went there to get that letter, and in that office they would say, no, we need another letter from this other authority. So it was a constant passing the ball, like a lack of transparency situation, chicken and egg. So that is one other concern. There's no accountability, no clear accountability and transparency. And thirdly, from an innovation, innovation point of view, we also work with our partners who are working on digital health solutions, researchers who are working on digital health. And they also don't have a clear guidance on how and where the boundaries lie in creating new solutions. Young people are innovators, and they do a lot of new things, think differently than, I would say, the rest of the population, most of the time. And these organizations need a clear guidance on how to frame their work. So from an innovator's perspective, also, there's lack of clarity.
Yes, absolutely. On your second point, I did a study a couple of years ago in Canada, and for one innovator to get access to one data asset to build an app took 18 months, 140 steps with 9 different approvals, and would cost $50,000 and take about 18 months. Then, after all those numbers, the easy number to work out is how much innovation is happening, because that's 0. So, and it's nothing to do with the law, it's to do with the interpretation, the application of the law. And that is, sadly, a frequent challenge across many areas, so I definitely resonate with that. Moving along, so Nirmal, from your perspective, could you tell us a bit about the legal frameworks that are in place in Nepal that support the governance of data, and how effectively in your overall experience, do existing frameworks address the specific needs of digital rights for the indigenous populations of people in the Southeast Asia or South Asia, as we learned earlier on? And what are the critical gaps that still require attention?
Thanks, Eric. I think the health data governance reflects the general governance of the country, and if that is bad, then health data governance can't be good. And that comes from what we saw in the Mentimeter, the political commitment first of all, and constant political turmoil, and lack of priority, I would say, a lack of knowledge and priority both. And that's been evident in terms of the legal legislation development process. But if we want to go specifically with health data governance frameworks, there is nothing specific because we have what we call a data act, which is very generic, but it talks about data protection, privacy, and all those things, but it does not talk particularly about health data governance. And that mandate falls, of course, under the Ministry of Health and Population, which has integrated health information management system in place, and of course multiple committees that look at provide expert advice on data sharing, interoperability, data privacy and rights, and standards development and all of that. So that is the situation in terms of health. I'll talk a little about the general situation as well, where we are headed, because you asked what are the priorities. But before that, just to dwell a little on the challenges from data sovereignty perspective. So, I think first I talked about the issue of integration, data integration. So because, Nepal just went into, when I say just, it's been many years, but we are struggling. It went into a federal system from what used to be a centralized, monarchy. And now that we have a federal, we have a province, and we have a local government levels. And so there is a clear lack of, understanding of jurisdictions and who does what. And that leads to this chaos around, legislation and who is responsible for, developing legislation around data governance frameworks as well. That is one, integration. And the second one is, of course, data integrity in terms of, the population and subgroups that they represent. And for one, we find that, data integrity is not there because often, especially when we come to health data integrity, it is not representative of the population, some of the most marginalized populations. So their health needs and priorities don't get addressed. And that brings me to the point of data sovereignty, which is around, ownership and custodianship. So do groups like, Shay just talked about youth, and I would talk about, indigenous groups. Do they have a say in how their data is collected? Why? What is the purpose of that data collection? How is it processed? How is it stored? And how is it finally used? So the answer is obvious no. And now coming to this general, I would say stage where we are in Nepal in terms of prioritizing. So right now I'm actually part of the design of an e-governance project, which looks at, sectoral integration. So, this whole concept of data sharing, interoperability, standards design, payment gateway, and a consent layer, of course, secure data exchange platform, and a consent layer which ensures, privacy and all of that. So, e-governance act is also in progress, which would hopefully lead to, more areas of data sovereignty. I'll talk about the specific laws probably in the next question. Thank you, Eric.
Perfect. Love that. Thank you very much. So in that first round of questions, what we have really heard loud and clear is that there are real challenges the health systems are having today with respect to the ability to collaborate and share data, especially across borders and within countries at the same time. We have problems of the integratability and the integrity of the data. Privacy is often a challenge. We've heard that in several times in the span of the day. The clear lack of accountability report I read, it was titled Data Disarray recently, which is really everyone cares about the data and nobody wants to be accountable for it. And I know that, at least in that country, it was a challenge, and I imagine it's a challenge in many other areas. Lack of transparency, having lacking the basics of your foundation, and your challenges of your processes and the handoffs. That doesn't sound very good. But here's the good news. This is where a robust health data governance framework is truly intended to address many of those problematic areas that we've identified. So in our second round of questions, let's dig into that a little bit more. And I'll start with you, Jocelyn, if I may. So from your perspective, sitting in Malaysia, how can a global framework and building consensus and commitment across countries around what the needed legislative components are, how could that support countries in strengthening their local national health data governance approaches, and what are your expectations in terms of what regional and global leadership would really help support this?
Yep. So I think a global framework and the model law can help to increase interest and political will in the country, and hence to prioritize the need to strengthen the national health data governance agenda in the country and also the region. So one of the things that it can do is it can be used as a checklist or guide for the countries to check upon when they want to work on strengthening the national health data governance. We would know what is available, what is missing, and what needs to be strengthened. So this we can map and share to the country leadership and also the regional leadership to see what's the lack and what can be improved. And it can be also used as a guide for discussion with stakeholders to improve collaboration, especially when it involves different ministries or sectors in terms of health data governance, because health data is not just in the Ministry of Health, it's also about Ministry of IT, sometimes involving the economy and others. And if there's international interest and there's a guide and endorsed by other countries, I think it's easier to push to the country leaders, and they could emphasize on this agenda even more. I think we have to work hand in hand from bottom up and from top down, both ways, to push this agenda forward. Yeah, that's all from my side.
Cool, thank you. Clear endorsement for you there, Matilda. Not surprising, but still, nevertheless, important. Demonstrates both the value and importance of having that type of model law in place. Moving forward, though, so Dr. Park, so from the WHO's perspective, what do you see as the next steps to possibly seek endorsement for a global or regional approach for a health data governance framework at the World Health Assembly or through some other regional processes?
Thank you. Let me first respond to other panelists' comment. After hearing their concern, worries, and then challenges, I think the key success factor of the governance is trust. Trusted custodian of the system, trusted custodian of the data is a key success factor. In each country, by default, it is government. And to control government employers, we need law. And if you believe sharing benefit of the data sharing is much, much bigger than protection of my data. We should encourage data sharing across the country. Here also, so we need trust. Trust network, and then custodian of the trust network. Here, by default, UN agencies in health sector, WHO claims we are mandated to as a trusted network custodian. Because of that, I support Mathilde's idea, our principle, our model laws want to be discussed at the governing body of the intergovernmental organization mandated on health, which is WHO. Good news is, in October 2024, last year, WHO Regional Committee for the Western Pacific endorsed the Regional Action Framework on Digital Health in the Western Pacific. It has 5 action domains for countries to take actions in harnessing digital transformation in their country for people-centric health and healthcare services. Of these 5 domains, number 1 is governance, and also the data is important domains. And each domains, the 2 domains have very strong recommendation to member states if they wish to strengthen overall digital health governance and then data governance in the age of the digital transformation. That recommendation is very much in line with the principle of the data governance presented today. We plan to develop and then endorse guidance and tools. Develop means we develop the WHO Secretariat with partners, and those means we don't need to develop everything by ourselves. We want to adapt and then endorse tools and then guidance developed by our trusted partners, including Transform Health, to help member states further in implementing the regional action framework in their countries. I believe the model law and then also assessment tool and the proposed data governance principle are well fit into our action framework, well fit into the regional action framework on digital health in the Western Pacific. At a global perspective, next week, the WHO Executive Committee, EB, will discuss many items. One of the items is whether we agree on the extension of the global digital health strategy. Global digital health strategy was endorsed in 2020 with lifespan of the 5 years. This year's last year of the life cycle of the existing global digital health strategy. Secretariat proposed we want to have new global digital health strategy. However, give us time to develop this 2 years, and then please allow us extend life cycle of the existing global digital health strategy. After EB discussion in May, World Health Assembly will make final decision on the extension and the renewal of the global digital health strategy. I hope our member states will agree on this. Then they will either create forum to discuss what should be priority and what should be strategic objective of the next global digital health strategy. Because this area is rapidly changing, we need to listen to many partners. And I have strong belief that data governance in digital age will become one of the most important topic for the discussion. To this happen, we need guidance from our owners, which is governments, And then to make this happen, we need the contribution of the stakeholders, ecosystem players in this area, ecosystem players in this data area. You are key stakeholders. Please listen to the World Health Assembly discussion. Please participate in the discussion to build trusted this data governance for the future. Thank you.
I share in your hope for the renewal. I think it is absolutely critical. I really enjoyed how you started there talking about the importance of trust, because we often think about we have to trust the systems, and I find often what we don't think about is, well, what if we don't do health data governance? What are the opportunities that we lose as a result of that? And one of the, we have a report coming out later this month where we ask patients, what do you think about the health system and what is the digitalization of it from your perspectives? And they report they lose trust in the health system when they keep on getting asked the same question over and over and over again. If the systems are digitalized and we keep on asking the same question, they know you're not using their data efficiently and effectively, and so they lose trust in the system. And so I think one of the things we have to do from a health data governance perspective is optimize use of the data and reuse it much more, such that we then foster better trust, and because we demonstrate to the public, this is how we're using your data responsibly, ethically, and effectively. So, having said that, I want to see what type of controversial things Shay may bring to the table now. She promised me she was going to be controversial. So, what are your expectations? I don't know if I'm setting you up properly here or not, but I'm going to go with it. What are your expectations of governments and other stakeholders when it comes to ensuring that your data is responsibly used and protected? And how can governments ensure that youth voices, particularly those from underrepresented regions, are not only heard but acted on?
So some of the things that I wanted to say have already been highlighted, such as transparency, and also this needing to be across country and addressed in a way that is regional and cross country. So I'll start with collaboration. So one thing that we've been noticing, I've been also personally, not just as a group, noticing, is that we don't collaborate enough. Some of us, because I've also worked in different, I would say, settings. I work a lot in the SRHR space. I work with lawmakers, constitutional law, practice constitutional law. But we do a lot of work that would be nice if we work together, but we tend to work in silos. And we always talk about collaboration, but we don't really collaborate. So something that Yet4H has been trying to do is to influence these different spaces that are not traditionally looking at health data governance, to make sure that they also know what's happening from our end. Example, we did a session on meaningful youth engagement and health data governance at the Digital Rights Festival in 2023, which is traditionally a space where cybersecurity, data privacy, platform accountability is addressed, but health data governance was a new topic for them. So that kind of showed me there's so much for us to do in terms of collaboration, because we've all been working a lot, but we've been working in silos. So, and it's like it's a bitter pill for all of us to swallow. But yeah, one thing is we have to stop working in silos. And in terms of collaboration, it's when you say like governments, the policymakers, lawmakers are often very disconnected with the grassroots, the ground, young people. So to have more intentional and meaningful ways to engage them. So we talk about having a seat at the table, right? Having a seat at the table is not enough. we also need to know, or have a say in what's there in the menu also. So that for me, quite simply, is how we can collaborate as young people. And also, we also often leave behind certain communities. When you take health, I was taking the example of persons living with HIV. We don't it's for a lot of the time, it's like a topic that people don't like to discuss. Sex workers, they are often criminalized. They are, or more often than not, outside the health data system. People from the LGBTQI community, again, face a lot of challenges, especially queer trans folk, where folks, they are like the transitioning, the hormonal therapy, all of that could potentially be weaponized against them. And I've seen instances where it has been weaponized in my country also. So hear from them, get their input as well, make sure that system covers them as well. And also, so that's one aspect of making sure that everyone has a say in collaboration. So that way, what we will end up with would be that much more diverse and inclusive. So that's one of the most important things that I wanted to say in terms of who needs to also be included. I'll stop at that, and if I have a chance, then I'll restart this.
We'll try and make sure that you have a chance. Thank you for that, because from a collaboration perspective, we want to get to a place where 1 + 1 = 3. As we've heard, what we often don't say is the opposite, which is that when you don't collaborate, 1 + 1 actually equals 0. It's not that it equals 1, because you are negating each other's value because you're creating more noise than signal. When you create signal, which is the 1 + 1 = 3, then people can act with confidence. When you can't act with confidence, oftentimes people don't act at all. And thereby, you get to 1 + 1 = 0 when you aren't collaborating. And I really appreciate you bringing it up. I think that's really important to break out. So, having said that, let's shift focus a little bit. Well, not really. And from Nirmal, from your perspective, representing a different view, how can we ensure that the important concept of data solidarity is achieved while respecting the rights of indigenous populations and marginalized communities, and how can a model law help support and strengthen our efforts through the creation of national data governance frameworks?
Thanks, Eric. I'll start with why the data sovereignty of indigenous people is important. That's because they have very specific needs that are relate to their environment, their food habits, their land use patterns, the way they interact with nature, and the indigenous knowledge that has existed over a long time. So there is a lot of knowledge there about health practices, and which can be useful generally. And that brings me to the point where digitalization of health, despite all its advantages, also brings this kind of danger, I would say, where corporates, big corporates, exploit that indigenous knowledge, and take away the strengths of those populations. Thereby, that would be twofold. One would be, it would be exploitation. The other would be depletion of resources that exist there, because indigenous populations actually depend on those resources on a daily basis. And coming back now to your question of, data solidarity and sovereignty and how the model law can support, I have a few points. So, I would say health data governance frameworks, should adhere to, First Nations principles of OCAP, which is ownership, control, access, and possession. And this is outlined in many international frameworks and covenants, including the CARE principles for indigenous data governance, which is, as we all know, C, collective benefits, authority to control, responsibility, and ethics. The GIDA Alliance, so Global Indigenous Data Alliance. There's also the Asia Indigenous Peoples Pact, and which has developed the Asian framework for knowledge and data sovereignty. So there are so many instruments there that can be tapped on for health data governance. So the second one is, of course, the importance of informed consent, especially in research, especially around transparency around the purpose, the use, the risks and benefits of that research. The cultural sensitivity, and like I said, the health data collection and use should respect cultural values and traditions of the indigenous populations, which has been, there since ages. And then the fourth point is, of course, collaboration and partnerships, and researchers, government, and indigenous population groups can come together to, move things forward on data governance. And also the fifth is capacity building. I think it's very important that indigenous populations are supported to develop their own data governance structures and are provided the technical skills to manage data. I know this is difficult, but over time this has to be done. And then the last one, which is of course transparency and accountability, which we just spoke about again. So researchers and organizations need to remain open about how data is being used, and about the privacy, security, and access. And on the model law, of course, I think because of its scope, we are talking about something at the global, regional, and country level. So I think that, and despite all the, I probably painted a gloomy picture when you asked me the first question, but we are at a cusp of where we have all these instruments, including the model law that can actually be adopted. And countries can, because I know equity, inclusion, and all of those points are very well addressed there. And Mathilde talked about, how that can be translated into country-specific, laws, and I think that is where people like us, all of us, have to ensure that the interests of indigenous people are actually ensured during that process, or it gets lost, and we lose the opportunity. So that's why that is important, and that brings me to Dr. Park's comment on trust. I think is very, very important. I would add that if we build an environment of trust and mutual relationship, the job gets done better. And this is mutual relationship between all parties, and that includes the indigenous populations themselves. Thank you.
And importantly, that having a seat at the table isn't a seat at the table. It's having a meaningful involvement in the conversation where your voice is heard. I was at a citizen assembly in France a couple of weeks ago, and 70+% of the recommendations to the citizen assembly were adopted by the French government in the adoption and advancement of the digital health platform. So those are novel ways of meaningfully, demonstrably engaging the population and thereby fostering trust with said populations. And I think those are great examples of what we can do. So, morning question time. I'm hoping you guys are keen. And while I'm pausing for people to be brave and go to the microphone, always ask the first question, never ask the second question. There's no expectations for the first question. So you just get up there and go for it. But meanwhile, I'll be provocative. So one of the things you talked about was the importance of informed consent. So this is an area that I'm going to be especially provocative. What are situations where informed consent causes harm? Because, as I've experienced sitting in Europe, the over-application of privacy laws based on talking to the public health space, talking to researchers, talking to safety advocates, is causing harm. And in many ways, it's causing harm because there is this expectation that you must have informed consent, not just for clinical trials, where it totally makes sense, but also for everything else. And that's where, from at least in the European health data space, they're talking about opt-out provision. So they assume everybody is opting in for everything. They allow people to opt out. But importantly, they say, there are scenarios where you cannot opt out because the public good of the use of the data is more important than the individual good. Now, obviously in those situations, there are extraordinary measures to make sure that data are protected and anonymized, et cetera. And there are severe penalties if somebody gets anonymized data and does bad with it. But I'm just curious, and I haven't seen anybody get up to the mic, so I get to ask the question. So when I say all of that, I'm curious what some of your reflections are, because I admit that's a perspective I've been developing from sitting at the OECD with countries that have had mature privacy laws in place for many years. I've recognized in many parts of the Western Pacific region that they don't have as mature laws in place. Some of them do, some of them don't. Yeah. And so I'm not sure if that's something that is resonant or it is necessary to start with privacy in order to foster the trust, and then you can calibrate after the fact. And what I'm seeing across OECD countries is that they're now at the second stage of privacy, not the first stage. So I'm curious if that has resonance or what we potentially should do in that space. Anyone want to take that?
I could take that, yeah. I think generally speaking, what you're saying, Eric, is right, especially when you talked about the benefit being for the larger population rather than an individual. But when it comes to, I think, when it comes to a very specific group, like my presentation is on indigenous populations, so I think there, the informed consent, why the informed consent is important is because first and foremost, you know, like especially around research, you know, and data is generated from research. And when researchers come, I think oftentimes what happens is because these groups are so marginalized and, you know, they cannot speak up, they don't understand what is happening. The first and foremost, the purpose. Why am I being questioned? Why are these questions coming to me? What will be its use after I answer, you know, and what will come out of it, you know, what is the outcome, you know, what do I get back from this process? And without that understanding, and when I say informed consent, it is about this. So, you know, an understanding of why my data is being taken, what will happen with it, and how will I benefit from that? So I think that is the important side.
Love it. And go ahead, Shay.
A few points to add to what Dr. Nirmal said. So in terms of resonance, I come from a South Asian country, and while we do have data protection laws, we don't have a data protection authority established yet. The act just came into force in 2022, and it doesn't address health data specifically. So there's not a lot of resonance because we haven't had health data protection. Health data governance is a very new thing, if at all. Like most people don't know about it, and it also very much depends on who you are consenting to, what is the entity that you are giving consent to use the data. Most, like, for example, in Sri Lanka, like, digital health solutions are mostly owned and operated by private entities. Like a telemedicine service, you give a lot of your data, and then you happily sit for a week, and then you wonder why you are getting a plethora of messages about this service, that service. So it depends a lot on who you give consent to. So if it's a private party, I don't think there should be like an essential mandatory thing, because for the state, again, my personal views are very different. I think a lot of these systems are very extractive. Research, even research, the traditional research systems are very colonized, and very extractive systems. So yes, even if we give our data, to what end has always been a question. Like when I do research papers and when I give, say, a survey, the amount of information we ask from the respondents and to see how much strain that they have to go through to give that data, health or otherwise, a person may feel that it's very extractive. So we have to find like an entire alternative. That's, I think it's a bit too revolutionary because you have to replace an entire system for that. But it depends on who you are giving consent to. In my context, because we don't have that overarching governance, like data governance system. So very subjective. So in our context, I don't think there necessarily has to be a mandatory option unless, because there's no data system, like the governance system.
In particular, one of the largest words in the first infographic we had was corruption. Like that just begets that, well, do I trust the people I'm doing this? I'm giving you the data. Even if you say there are penalties, are the penalties going to be enforced? Do you have a model law or any type of privacy legislation without the people to enforce it is more or less meaningless.
I would say some different perspective, different angle on the informed consent. I think informed consent is a possibility of the abuse of the informed consent because of the asymmetry of the information, asymmetry of the knowledge. Let's say the people, indigenous people, rural people, I don't think they know everything about what does it mean I signed informed consent. Because of that, we need trusted custodian of the system, because I believe the goodwill of the governments. Government should control or oversee the players who really has the potential of the abusing informed consent. Let's say, let me say some example, by personal example, not health sector, but banking sector. After many data security breaches, I need to sign many informed consent when I want to open new bank accounts. If I don't sign, I will not have new bank accounts. If I don't sign, I will not be able to transfer my money to account 1 to account 2. So I'm forced to sign informed consent. But I'm happy to do this because I trust my government is controlling bank for them to not abuse their power of getting informed consent. Yes, informed consent is critical, important. However, I want governments exercise good custodian role, overruling all the data sharing and then protection ecosystem.
So it's really making sure that the people, the processes, the oversight is in place to ensure that when people have access to especially sensitive data, that they're using it for its intended purpose. And if they ever were to use it not for its intended purpose, then, as I refer to the Marvel Cinematic Universe, the hammer of Thor will come down on them. Because this is going to be really an important thing, because that is an important aspect of trust. And in a real way, if anyone comes along and does something bad with the data, then I would definitely say we need to be clear what the penalties are, and being clear it happened, be honest, and this is how we addressed the problem, both in terms of the penalty and how we're preventing it from happening going forward. So I think all of that is important. Do you want to get in on this, Jocelyn? I'm curious.
I could add to that a bit. Just a bit. Yeah, I think, yeah, the trust is very important, apparently, yes. And just that my data does not get misused or, does not get exploited in some way. I think that is why I said, informed consent is, of course, it should not be weaponized or politicized, I think, like Dr. Park said, sometimes. But there's the other side of this is, when if as an indigenous person or a community or a group, when I understand, the outcomes of good data from good health data from my community, I can use it as a tool for advocacy, for ensuring that my services are streamlined to my needs, to my community's needs, and that's a great advocacy tool, and that is very empowering. I think we talk about empowerment at a lot of forums, but these are the small things that empower, so that is why it is very important. Yeah, I'll just add that.
In terms of OCAP for indigenous populations, that's the ownership, control, access, and possession, so they can do the analytics to understand their own communities so they can, as you say, advocate for their positions to governments. Anyway, sorry, Jocelyn, over to you, madam.
Yeah. So I actually agree with what Tidong's mentioned about the trust is important. So the process of getting the informed consent is much of concern from my side. So for people to understand what they are consenting is very important. The way, how do we get the informed consent? As a researcher myself, I think is very important. Sometimes we will just read it out to them and they don't even understand what they are consenting to. I think other than, they might give the consent because they trust the government. So to educate them in a way that they can understand what we are collecting is also important so that we can work together to govern the data, especially, yeah. And also for patient safety, and they will understand what they are giving and what they are involved in. Over.
Cool. So what this all leads me to think about, and I noticed nobody's going to the mic. Question or statement?
Good afternoon. Thank you all the panelists for your very enriched discussion. I just like to, it's not question actually, I just like to clarify something on the topics that you are discussing. First of all, I think mainly I'll focus on the indigenous issues. Because both Nirmal and myself, we work on that paper. So here, first, I think we all understand that indigenous peoples, they still have their own political and social institutions. They also have their own worldviews, so that we have to admit first. Then, when we talk about the informed consent, you just took informed consent, but it is free, prior, and informed consent. So to be complete, it has to be free, prior, and informed consent, FPIC. Why? Talking about consent, what kind of consent? It has to be free consent, free from coerce, free from money, bribe. No, sometimes we give consent with taking bribe, taking money, taking opportunities. That can also happen. That is why it is free. Free from all, when we give consent, it has to be free from all those things. Then prior, it has to be the information. When we call informed, that means there are both positive and negative sides of whatever we do. So we also need to inform them that if we do this, there may be this positive things, and there might be that negative things. So we have to be very well informed of both negative and positive. So after knowing all these things, if I give consent, that is called free, prior, and informed consent. And finally, also indigenous peoples have to have that right to say no. Knowing everything, I want to say no, I don't allow you to come to do research in my community. And second thing regarding the health issues, I think, when we talk about all this FPIC, I think, yes, sometimes we as individuals, we don't want to share many things of my own diseases, for example, my health problem. due to many reasons. But when we talk about the remedies, for example, indigenous peoples also, they have their own knowledge on treatment, and they have, for example, medicinal plants. Sometimes we use them without their consent, and the profit is made by some other companies. Here comes the intellectual property rights and the patent rights. So they are still indigenous peoples are struggling. So, and here comes, as you said, the individual and collective rights. So some knowledge, some skills is individual, but there are some knowledge, some skills who are actually owned by the entire community. So this thing I just want to share. And another thing is, when we talk about the capacity building should be not only for the indigenous communities, it has to be for both, because the government, the policymakers, they also need to build up their capacity, because they also lack a lot of knowledge about indigenous society, their own values, life system, etc. So yes, thank you so much.
Thank you. Thank you for all that fantastic and very relevant information. Having said that, let's go to a question.
Okay, thank you for your time. My name is Rijal. I'm from Indonesia. From the past conversation, the panelists talks about trust about the data. So, according to the panelists, how can the governments increase the public trust about data collection and data governance? Maybe just what do you guys think about how we increase the trust in the public for the data collections? That's all. Thank you.
So, thank you. So, I'll tweak it a little bit and say, how do you think the existence of a model law or some form of health data governance helps increase trust, and what should we do actively while implementing the governance to make sure that we are fostering and improving the trust? Who would like to start?
One suggestion, can you invite Mathilde to this podium? Join as one of the panelists.
Yes, thank you for that. I appreciate that. This seems like the right moment.
Yeah.
I warned her I was going to do that, but I forgot. Thank you.
To join.
So if I may, as a response as a first. So trust to the government. However, government should be governed by law, not governed by the will of the politicians. Because of that, we need law. Because of that, and the law should be based on the international agreed standard. Why? We want to share data across the country because it is more benefit. If country A law is based on the principle one, another country based on another principle, we cannot share the data. Because that I believe that model law country want to be consult this, we hope that they adopt the principle of the model law.
Yeah, sorry, I think I missed the question. Can you repeat it, Eric?
Pretty much, it's given the fostering of creation and adoption of a model law for health data governance, how would that help improve trust with the public, and what actions should we take in order to foster that trust given the implementation of health data governance?
But by governments, you mean? Yeah.
By governments, but if you have other ideas, I'm open to. We have youth groups, we have civil society groups.
Right. Yeah. So I think it's really important that we establish these. I mean, we have these frameworks, right? So first of all, I think we need countries to come together. We have been advocating for a health data governance framework for many years now. But I think where the roadblocks lie is that in order for something to be put onto the World Health Assembly, countries need to request the WHO to put it onto the agenda of the WHO. And so someone said earlier on the panel, there needs to be a bottom-up and a top-down approach, right? Where we ask, countries are requesting or pushing for the need for a global framework to establish these common standards that all countries can agree to, that would also facilitate better, as Eric said, cross-border data sharing. Because if we don't have these common standards or common agreements of what constitutes good data governance, we will not be able to share data across borders. So that's one. But I do think in that process, we all play a really important role as civil society, as youth groups, as rights groups, as indigenous groups. We need to make sure that whatever is tabled at the WHA is representative of all the needs and rights and perspectives that we have in order to ensure that data is governed, well. And so, we all must play a role in that. And I think what we have been doing at Transform Health is really to consult these different groups and bring these different perspectives together to develop frameworks like the model law and also the health data governance principles, to make sure that we have all those perspectives around privacy, around security, around ownership, etc., really at the center of the conversation. Thank you.
I'll just add to that. I think representation, meaningful representation, like Shay said, not just a seat at the table, but also a say in what is on the menu. That is very important. And right now, we are two stakeholders here, one representing youth, one representing indigenous populations. But I think there are multiple stakeholders who have an interest in data governance provisions. That is number one, to answer your question. So I think trust begins with that, through representation, that I am being represented in this process and the outcome of this process. Number one. And number two would be, of course, what we just discussed, like the model law. The model law would bring, I would look at it at two levels. So one is policy, the other is practice. So at the policy level, we need standardization. The world needs standardization. So, you can't have different standards governing different countries, at least on this area. So we need a standard process, and that would build trust. And at the practice level, I think, then we customize, because we have our own individual needs, although we talked about standards, but we can customize to our country's specific needs. So that would build trust, I guess. That's my take on that. Thank you.
Shay, do you have anything to add?
Most of what I wanted to say was shared by Dr. Nirmal and Mathilde on specifically like how you engage. I'll just share a personal example, something that I wanted to say if time permits. So when I was 5 years back, when I was younger, I was invited to be a youth representative at this technical advisory committee at the Family Health Bureau in Sri Lanka. I think when they started, it was nothing more than a tokenized measure. I was just sat there for a couple of sessions and then just absorbed it. But then slowly, they invited me because I work a lot with the deaf community in Sri Lanka, and they wanted that perspective. So then, like, in a couple of times I gave some inputs, and then they started taking it seriously. And they realized that there's certain perspectives that they've been missing that came from me. And from that, it was a journey of them giving me more trust and me trusting them in being open about my issues and being more radical at that table. And I think now going forward, they have invited more and more young people, and they rely a lot in mobilizing their youth activities on like other youth organizations. I'm no longer there, I've stepped down. But for me, it will remain that example of duty bearers, state, the policymakers, trusting, and us who, like, I went there mistrustful for it to be another tokenized thing, but I went there, and for me, like, it's just an example of what Mathilde and Nirmal said. in how representation can go such a long way now. A lot of the communities that the Family Health Bureau is unable to capture at that point, like the estate worker communities in Sri Lanka, the deaf community, they are in the table now. So it is like forever would be for me a case study and an example of how representation could change the game.
Amazing. Admittedly, when you're describing it, I had this momentary vision of dating in my head. But then I had a better vision of just the mature process of how you earn respect and mutual respect. And you fostered that through a consistent relationship over a period of time where both parties were happy to partner to try to learn how to earn respect and in fact achieve that, which I think is really important and powerful, which I suppose means one of the key ingredients in this is patience. It does take time, but it's time well spent in the overall process. So before I go to Jocelyn to see if she has any thoughts, I'm going to give a warning to everyone, including you, Matilda, for any final remarks you may have. But before I even do that, I will invite, if anyone else wants to be brave and come to the mic, go for it. Sir.
We are told we have to be patient, but time does not seem to be on our side, because the speed of technological developments on one hand and the capacity of our societies to get together is still a serious question. So my point here is the issue of this session is on leadership. And as it can be said from Dr. Park, the world of unequal powers or asymmetry, we live in a asymmetric world still. And there are certain regions that are more experienced in governance, data governance. But now my point here would ask for leadership. How should leadership move ahead not as a model? Because a model is just a model while contexts are very different. And the issue is still very much related to inequality context of each societies and politics. So my point here relates to what would you be the suggestion for us to move ahead while the time, in certain way, we need patience, but we also need to accelerate the speed of our capacity building together, because this very unequal world of power, geopolitics of this kind of technology, so even more necessary trust among us to be created. May I ask you the question for some suggestion?
So my summary of that is the world has never moved this fast, and it will never move this slow again. So it is just accelerating, and we have to find ways to keep up. And I think the term that I heard Amandeep say in the plenary session was talking about the need for adaptive governance and adaptive approaches. So I suppose my question is, as we are thinking about a model law and thinking about its implementation, not literally, but its overall approach, what are some things and advice and or observations that folks have had around how adaptive governance would work in a practical way? Are there real examples that we have, or is this a problem that we have to find a way to overcome? I have stumped them.
I think Eric should answer this. I think it's all about cross-sector collaboration. I think we cannot just rely on government to regulate data, right? It has to be a cross-sector effort, and I think we have to be very open to what the private sector have to say on this, right? They have a very important, they are developing all of the new technology, and so we need to listen to what the needs are as well, and then ensuring from an equity and inclusion perspective that we're also listening to the needs of the people, right? So I think we need to have these different levels represented in the conversation, and when we are designing these frameworks, whether it's at the national level, at the regional level, or at the global level.
Yeah. And what within that are, here are the red lines that thou shalt not cross, here are the things that you should do, and this is how we adjust and adapt when we need to. So, and here are the things that we will never change because they are hardened. This is how the world works. These are the things that this is our best understanding of today, and it may change, and just having different types of laws and the speed at which you can change each of those things are fundamentally different, the things of that. So we need to find ways, and I will share with you, nobody has solved this problem. And so this is a challenge that many folks have. So with that said, I'll pause, and I will start to ask the panel for your closing thoughts. In a couple of minutes, what are your reflections of what you've heard, what you've listened, and what, most important, what one thing do you want everyone out there to remember after we're done? So I'll start with Nirmal.
Okay, thank you, Eric. I mean, I'll just carry on from that question, I think. And, a couple of days before, I went out on the field trip organized by PMAC. And I was in group 2, so we went to, what was the name of the hospital? Ramathi Body. So at Ramathi Body Hospital, we met with, one of the speakers. He was the key speaker there, actually, was anybody from Thailand would tell me. He is a regulator with your AI, body, regulatory body, Dr. Sak. Does that ring a bell, Dr. Sak? Anyways, so, and one of the things he said was, he was talking about regulation and the pace at which technology is moving, and the difficulty of keeping pace, regulation keeping pace with technological development. And what he said, and coming back to adaptive management, what he said is like, oh, I just don't enforce any regulation. I let it be as self-regulation. So, I think there's a big role for both government and civil society to actually educate people and say, okay, this is how we move forward. I think it probably won't help that, regulation comes with do's and don'ts and penalties and fines and all of that. Rather, it would help to, educate and bring down those incidences where we have, all these cases where fines and penalties would be imposed. So yeah, those are my parting thoughts, I would say. And this also comes from reflection from my participation in these 5 days. Thank you.
Excellent, thank you. Jay?
So personally, this has been a very thought-provoking session for me. My final thought and what I would want everyone to think intentionally is specifically on inclusion and representation. Young people often get represented but not meaningfully enough. So to think about it more seriously, take it from the discussion that we had today, and also to intentionally include anyone and everyone who often exists outside health system, legal system. Queer folks, LGBTQI community, women and girls, migrant workers, people who don't get the same benefits of a health system as a typical person. Typical is the wrong word to say, but an average person would be getting. So think about inclusion and meaningful representation and engagement a little bit more seriously.
Thank you, excellent. Jocelyn, just checking that you're there, good. Over to you.
Yep, I'm here. Yeah, so from today's panel, so what I can say is health data is different, it's special, it's sensitive, and hence Patient safety and universal health coverage should be in our mind when we work on this, when we work towards governance or anything else related to health data. Just to quote a very old saying, if you want to go fast, you go alone. If you want to go far, you go together. So collaboration and trust are important in this. And digital health transformation is no doubt very fast. And there are many new technologies that are coming out daily. And if we don't have a way to govern it at the most basic level, we can't actually go far. And we have to also understand it collectively, not just from government perspective, but also from all the sectors. So yeah, that's my summary for today. Thank you.
Thank you very much. I love that quote. Dr. Burke.
Yes, I want to quote a very famous African proverb. If you want to go fast, go alone. If you want to go far, go together. So my one message is, let's move forward steadily together. We all believe the benefit of the data sharing, but we want to address concerns and then challenges. We believe good data governance will address our concerns, will maximize our benefit, and then model laws will govern the good data governance, and the big hands to materials, and then transform health. To lead this slowly, however, steady step up to here, we want to go far with you together. Thank you.
Wow, fantastic. So, how would you like to respond?
So I would say, achieving equitable health data governance is not an easy task. And for all of us to get there, it requires a concerted effort. And I think we all have a really important role to play. Whether we are working in a government, whether we're working at the regional level for the WHO, whether we are representing a civil society organization, or whether we are just a health seeker, right? Wanting to get access and know how our data is being used on a daily basis. We all have a really important role to play. So I think I would say one thing that I would ask everyone to take away is, don't underestimate your own voice in this. Write to your government, put on the table how important this issue is. Go out and take action, participate in the My Data Our Health campaign. You can find out more about it on our website. And that's a first step towards campaigning on this issue. If you are representing an organization, join and endorse the health data governance principles and join us in our action to advocate for national legislation and also regional and global frameworks.
Awesome. Thank you. So with that said, I've heard and learned a lot in these last 2 hours, so thank you for that, everyone. I've learned that from a partnership perspective, we want to be really focusing on the 1 + 1 = 3 and avoiding the 1 + 1 = 0. We want to be investing in capacity, the human capacity of our systems to adapt and apply the practice of health data governance. And here's the good news. Investing in that human capacity is way cheaper than investing in billion-dollar systems that don't get the return on investment. And so we need to think about when we're investing the billions and billions that we do in large technology systems, especially around artificial intelligence, we need to think about the lost opportunity cost of not investing in the human foundation of data governance that ensures that we're getting optimal value out of those investments, because that is a drop in the bucket from the overall investment that we have. We've learned to be adaptive in our governance practices. And we need to be thinking about how to meaningfully include and have multiple voices at the table and feel proud and strong that we deserve to have our voice heard and insist that our voice is heard. and not take no for an answer, if I can just put it that way. Like, we must do this together if we are going to be successful. And one of the last things I heard is, this is ultimately around safety in many ways. We want a safe health system. And this is where the ironic analogy I draw is that much as doctors and nurses and health providers, their credo is do no harm, from a digital perspective, that is our credo too. Our job is to minimize the harm that is done, and we must minimize the harm through both the use of the data and its protection. And that is my final message for you. We must find a way to get to yes in the use of the data while ensuring it's protected at the same time. So with that said, I would like to thank the panel. I would like to thank the organizers. I would like to thank Jocelyn for coming into the last minute. And all of that said, thank you, audience, and have a great remainder of your day.